Vernon is a pediatric physician who has a family practice in Loris, Kansas. And as well as being the medical director of the University of Kansas Weight Control Program and the current president of the American Society of Pediatric Physicians, she is the co-author of a book called Atkins Diabetes Revolution, which was published in 2004. At an ASBP seminar, she heard a presentation on the positive results of limiting carbohydrate on the body. A short time later, she was studying for her boards and reading a biochemistry book about the primary function of insulin, which is fat storage. And she says, like a cartoon, she had a light bulb moment. The pieces fell together and it dawned on her how carb reduction could help people. She was a little concerned about safety. That's what she says. I quote, "I became a data gathering nut, collecting all kinds of information about her patients' health as they changed their diets." She then collaborated with researchers to find out how lowering carbs was affecting her patients as a group. Dr. Vernon found the results very startling and positive, and her patients were actually thrilled, and she loved seeing the difference in her patients' lives, especially after her previous frustrations. She likes to tell the story of a medical student working with her after the first day of seeing one happy patient after another. She said, "I feel like I'm in an infomercial." Now, one thing Dr. Mary Vernon focuses on is metabolic markers. She doesn't focus on weight. She feels that focusing on weight is missing the boat because weight is only a marker for an underlying problem. And this problem is a difficulty processing glucose, a difficulty which begins with, of course, insulin resistance, and can progress through various stages, ending with diabetes. Correct the problem, that results in weight loss. And guess what? The easiest correction is simply to give the body less glucose, aka carbohydrates. Two of the most consistent results when a person first reduces carbohydrates are dramatic drops in triglycerides and an increase in HDL. And interesting enough, these two metabolic markers actually inform the doctor whether their patients are indeed following a low-carb diet. It is this type of attention to detail that has led Dr. Vernon to becoming one of the foremost physicians in the field advocating carbohydrate restriction for weight loss and the treatment of diabetes and its precursors. And she frequently lectures at conferences, continually educating other doctors about the latest research. Dr. Vernon, besides working with her patients on low carbohydrate diets, really aims her attention and focus at helping other physicians understand how to diagnose glucose tolerance problems before they progress to diabetes, the biology of low carb diets, and the specifics of how to use low carb diets with their patients. She helps other physicians understand the importance of medication and possibly dosage changes during a low carbohydrate prescription. And she helps them to understand the role of diet in the progression of the diabetes progress.
Now, please don't be mistaken. Dr. Vernon does take people's daily lives and activities into consideration when she does prescribe her low carbohydrate diet.
My conclusion when it comes to Dr. Mary Vernon's interview is that I want to find out how to get as healthy as possible using natural methods such as diet, exercise, and perhaps a supplement here or there. I believe the idea to eat less fat and less saturated fat was certainly a mistake, and I believe a mistake for profit. I believe that is the reason behind the epidemics of obesity and diabetes. And the more and more people realize this, I believe it is time for a health revolution.